Hello everybody, today we're going to be talking about movement and exercise-based myths as it relates to lower back pain. This is a continuation from the last video, which is the medical myths about lower back pain. Check it out over there. Just check it, click that one. But without further ado, let's just jump into it. Number one, pain related to exercise and movement is always a warning that harm is being done to the spine and a signal to stop or modify activity. But no. In fact, graded movement and exercise in all directions is safe and healthy for the spine. Yes, flexion, extension, lateral flexion, side bending, rotation, the whole lot. And pain with exercise and movement does not mean that you are doing harm. As stated in the previous video, pain does not necessarily mean that there's tissue damage. Also, many people and clinicians seem to think that there are certain dangerous movements for the spine that should be avoided. And we will get into this a bit later, but that is utter nonsense. All types of movements are safe and healthy for the spine, so long as you have the necessary capacity to tolerate the force and the load of which you are exposing to it. If you progressively build up your tolerance for that movement, you will not be at risk for harm, tissue damage, or injury. The spine is incredibly resilient and isn't susceptible to damage just by moving it in an unorthodox position. Number two, lower back pain is caused by poor posture. No. First of all, we actually don't know what poor posture is exactly. Posture has very little to do with pain and function. And spine posture during sitting, standing, and lifting does not predict lower back pain or its persistence. A variety of postures is healthy for the back, and it's safe to sit, stand, and lift with a rounded back as well. In fact, it can be more efficient. Yes, this is true. People have the understanding that sitting with a rounded back, rounded shoulders, a poor posture for too long can cause maladaptations to the spine and cause structural deformities and pain, but this is not the case. The problem is that the body tends to react poorly to sustained postures and inactivity. But it doesn't matter what those postures are. The main takeaway is that the body responds very well to variation of posture and movement. It's not one particular posture that is the issue, but sitting in any position for too long, that's what causes discomfort. Posture is very rarely correlated with pain, and we see this in research too. There has been plenty research done on individuals that present with a rounded shoulders, kyphotic upper back type of posture, a anterior pelvic tilt, hyperlordotic type of posture, forward head tilt posture, etc., etc. And these individuals have been found to be not any more susceptible or prone to having back pain or weakness than anybody else. There's also the idea that lifting, squatting, or hinging at the hips with anything but a neutral spine is dangerous. But this again isn't true. And in fact, we know that deadlifting with a rounded spine might actually be more efficient and might help people lift more weight. There's no evidence to show that deadlifting with a rounded spine creates any more susceptibility to pain than deadlifting or picking up objects or lifting weights with a neutral spine. So this is utter nonsense. Okay, so the next myth is that lower back pain is caused by a weak core and having a strong core is protective. Now, this is a very outdated idea that we need to have a strong core and we need to activate deep core muscles in order to create more stability in order to be protective of the spine. But a weak core does not cause lower back pain. And we found that doing corrective exercises and core training isn't any more beneficial or superior than doing general exercises for lower back pain rehab. In order to strengthen your back, you have to expose it to repetitive load, and that isn't going to happen by focusing on breathing, sucking in your stomach, and activating the transversus abdominis and doing planks all day. Yes, the core and abdominals to some extent are involved in the movement of the pelvis and the trunk, but that's only one tiny piece of the puzzle. While it's important to keep the trunk muscles strong, it's also helpful to relax them when they aren't needed, because a lot of people have received a lot of conflicting information surrounding the core, thinking that it's constantly needed to be braced in order to protect ourselves when we move. And these types of people may develop some form of hypervigilance surrounding the core that can end up increasing sensitization to our lower back pain and not helping the cause. Number 4, repetitive spinal loading results in wear and tear and tissue damage. But no, Spinal movement and loading is safe and builds structural resilience, especially when it is graded. The whole idea that repetitive movements, whether or not it's from running, walking long distances, and repetitive flexing and extending of the spine can cause wear and tear in our knees and backs, is completely false. This is a very biomechanical mindset, and it negates the fact that our bodies are biological, and they don't respond to movement like mechanical parts or robots. Our joints are incredibly cushioned by synovial fluid and connective tissue, and whenever you're constantly mobilizing them, moving them, and loading them, they don't get worn down. They get flushed with blood, fluids, and nutrients, and oftentimes can respond positively to movement in the long term by adapting and becoming thicker and stronger. So backs do not wear out with everyday bending and loading. These movements are safe and healthy if you start gradually and practice regularly. It is when there is a sudden increase in load that perhaps your back isn't able to tolerate, that's where we see an injury occur. But it is not due to wear and tear. Okay, number 5 and the last one. Pain flare-ups are a sign of tissue damage and require rest. Now, this is especially important in the case of persistent lower back pain. But the fact of the matter is, pain flare-ups are more related to changes in activity and psychosocial factors rather than structural damage. Controlling the changes to activity and psychosocial behaviors and factors can help prevent these exacerbations and flare-ups. Rest is often not the best course of action. In fact, rest can be harmful in a lot of cases and cause us to become deconditioned, weaker, and cause us to fear movement. It is when we rely on rest for healing where we become fragile. So it is preferred that even when flare-ups occur, yes, it is annoying. Yes, it can be painful to move, but we must react with movement optimism and try to gradually return to meaningful activity in a way that is tolerable for you in your specific state. And that's it. As a takeaway, unhelpful low back pain beliefs may contribute to a negative mindset regarding back pain, leading to pain vigilance, fear of movement, fear of engaging in valued activities, and worries for the future. Coaching people to confidently engage with variable postures, movement, graded loading, physical activity, healthy living, social and work engagement can build a positive mindset regarding lower back pain. So thanks if you've enjoyed this video. Please let me know if you have any questions, concerns, or comments. Leave them down below, and I'll see you in the next one. Peace.